Welcome back to DC NSC. Our next segment is on an 11-year-old gymnast who was paralyzed a few months ago. Here's a clip on how she got hurt. This caused her to be paralyzed from the neck down. We have a doctor here today to discuss new treatment options for this girl. Hello, doctor.
Hello, Ms. Crook. How are you today?
I'm good. How are you?
I'm here to discuss the new carbon microthread, and it was discovered by the University of Pittsburgh, and it's created from a thin electrode that is made out of a single carbon fiber. And what it does is it's connected to a computer so that the paralyzed patient can turn thoughts into actions. It works initially by connecting the surviving neurons to each other, and that creates a pathway so the signals can reach the brain and down to the rest of the body. It is only about 7 micrometers in diameter, so it is very small, and it is coated in chemicals so that they're resistant to the proteins in the brain.
Wow, 7 micrometers. That's extremely tiny. Your own strand of hair is only about 80 micrometers in diameter, and this electrode is only 7. Doctor, how well do you think this treatment will work?
Well, hopefully it works well, but there are some risks with this product just because it is so small, and we are still waiting for the FDA's approval on this new treatment.
Okay, well, if you had to point out a certain flaw, what do you think that would be?
Definitely the size, because it is so small, and in our animal trials we had a lot of issues with it detaching from where it was supposed to be, and we're not sure if that will cause a clot or lead to any other complications later on.
Well, thank you, doctor, for enlightening us on this whole new treatment for paralysis patients, and best wishes to Sarah.
Hi Sarah, I have some bad news.
Okay.
After reviewing your x-rays, we saw that the microthread was torn in half and is no longer doing its job. We need to perform surgery to remove the broken thread as soon as possible so we can prevent migration, clotting, infection, or any other complications.
What? Oh my goodness, this is horrible. When will the surgery be done? Are there any risks? What if you can't remove it all? What is going to happen? Will she get worse?
Take a deep breath. Everything will be fine. We have very trained and skilled surgeons on hand, and we plan on putting in our best effort. Your daughter will be safe and healthy. If you'd like to come and talk with the secretary to schedule the procedure, she will schedule all the details, and then we can talk about anything other questions that you may have.
Hello?
Hello, Nicole. This is Dr. Katie. I got your message about possibly looking into new treatment options for Sarah. If you'd like to make an appointment with me, then we could discuss the new combination of treatment of injection of stem cells and electrical stimulation.
Stem cells? I don't want you taking stem cells from a poor baby.
Calm down. These cells will be taken from Sarah's own fat cells. They are differentiated into stem cells. How about making an appointment for Friday at 3 o'clock? Does that sound good?
That sounds wonderful. See you then.
Also, I wanted to let you know that the FDA has recently recalled the carbon microthread.
Well, isn't that good news? See you Friday.
Hello, Sarah. Hello, Nicole. I'm here with your PT that will be with us throughout this entire process.
Hi, I'm Bailey.
Hi.
Before Bailey begins going over anything about the electrical stimulation, I just wanted to talk to you briefly about the stem cell injections. Now, this treatment has been successfully done in the military on soldiers that have had completely severed spines. So with that being considered, there are definitely a lot less risks than with the carbon microthread, and there's less chances of it failing also. It's also going to require less invasion, and there is no surgery. The injection is of your own stem cells, which we will be getting from your fat cells, and we will be differentiating your fat cells to make them into adult stem cells. They will be injected in 3 different places on your back, upper, middle, and lower, and the injections will be done on Monday, Wednesday, and Friday. We can train your mom to do these injections at home if you would like. Do either of you have any questions?
None from me.
That seems pretty straightforward. Now, Dr. Bailey, can you please explain what electrical stimulation will be used?
Of course. So the type of electrical stimulation we'll be using is called transcutaneous electrical nerve stimulation, or TENS for short. The type of TENS that we're using is called acupuncture. This type of TENS concentrates the stimulation over the injection of the stem cells, and it's going to be at high intensity and low frequency. It excites your neurons, which will then contract your muscles, and it goes through your skin to get to your stem cells. This will be done for like 15 to 30 minutes per visit, and it's going to be done on Tuesdays, Thursdays, and Saturdays. So it's going to be the day after you get your injection, so they alternate. We will also be doing multiple muscle exercises in my clinic in order to help get your strength back in your muscles. This is the device we'll be using. These pads get stuck onto your back where the injection was done, and then this device here helps me to figure out what type of intensity and how much intensity to be done on your back at that time. So there's that. Do you have any questions? Do you understand?
Sounds pretty intense. I get Sundays off, right?
Yes, you will have Sundays completely free of treatment.
Oh, that's wonderful. Now, if I want to do the injections at home, is that possible and sterile and safe?
Yes, the syringes are completely sterile and you will be wearing gloves. The syringes are packed individually and are not to be reused. You will also apply a cleaning solution to her back before you inject the stem cells, and this is to prevent infection. The total treatment will last a few years. We hope that the end result will be that you get back the quality of life you had before your injury. This won't happen overnight, but over a few years we are expecting you to be walking again. And this is based on previous trials.
Awesome.
All right, thank you.
Okay, Sarah, now that it's been a full year of treatment, how are you feeling?
I can actually feel, I can feel the tips of my toes. I can wiggle them like this. On good days, I can point and flex my feet, which good days are coming more frequently, but I can also tighten the muscles in my leg, and even though I can't quite move them yet, I know it's coming with time. There's a lot more stuff to do, but with someone's help, I can move them.
We are so proud of the progress that Sarah has made over the past year. So, doctor, how much longer do you think it will take for Sarah to be able to move her legs like she used to be able to, since her treatment is progressing?
It's hard to say because all situations are different, but we are very happy with her progress so far and only see good outcomes for Sarah in the future. We are thinking of possibly decreasing the amount of cells being injected as well as decreasing the intensity of the electrical stimulation. We're doing this because we don't want to cause her body any stress because we keep constantly injecting her, and then there's the stimulation as well. Instead of filling the whole syringe with stem cells, we're now only going to inject 75 units, which is 3/4 of a syringe. The electrical stimulation is going to be changed from acupuncture stimulation, which you obviously know is high intensity, low frequency, and it's going to be switched to convention stimulation, which is low intensity, high frequency.
Alright, that sounds good to me. I was curious if her treatment was ever going to change because of her progress. It's been a pleasure working with you, and thank you so much for the wonderful progress she's made.
It has been an absolute pleasure working with you, and I look forward to seeing you guys in 2 months. Thank you for coming in.
Thank you.
And action. Whenever you're ready.
You hit your...
Let's start over.
Okay. And take 1. Or no, let's take 2. Going over anything about the E-stimulation.
Guys, I just moved my legs.
What'd you do?
She moved her legs.
You can't do that!
Do we have to seatbelt you down?
Yeah, the seatbelts are down.
I was like, why are you talking right now? We're in the middle of it. She's doing good.
Stop.
Calling
I
her
saw
fat.
that.
Calling my daughter fat.
I saw that look though.
Hello, Sarah. How are you like today?
I don't know.
That's terrible. Will be your PT throughout this whole process.
Hi.
Hi.
No, I knew that was going to happen.
I had to
Are you
take a
ready,
selfie.
doctor?
I had to take a selfie.